USMLE style question on type 1 hypersensitivity. A 24-year-old woman presents to the emergency department with sudden onset shortness of breath, wheezing, and hypotension after eating at a seafood restaurant. Her symptoms began within minutes of consuming shrimp. She has a history of seasonal allergies and asthma. On examination, she has diffuse urticaria, facial swelling, and stridor. Which of the following best describes the immunologic mechanism responsible for her condition? Activation of complement via the classical pathway. B. Deposition of immune complexes in blood vessels. C. Mast cell degranulation mediated by IgE. D. T cell mediated cytotoxicity. E. Delayed hypersensitivity reaction. Answer: C. Mast cell degranulation mediated by IgE. Explanation: this patient is experiencing anaphylaxis, a severe, life-threatening allergic reaction consistent with type 1 hypersensitivity. Type 1 hypersensitivity is an immediate immune reaction mediated by IgE antibodies and mast cell degranulation. Mechanism of type 1 hypersensitivity. 1. Sensitization phase. Initial exposure to an allergen, e.g. shrimp proteins, triggers B-cell activation and class switching to IgE production, mediated by IL-4 and IL-13 from Th2 cells. IgE binds to the FcRI receptors on mast cells and basophils, sensitizing them. 2. Re-exposure to the allergen. Allergen cross-links the IgE molecules on mast cells, leading to degranulation. This releases histamine, tryptase, leukotrienes, and prostaglandins, causing vasodilation, hypotension, increased vascular permeability, edema, bronchoconstriction, wheezing and respiratory distress, skin manifestations, urticaria and angioedema. 3. Clinical presentation. Symptoms occur within minutes of allergen exposure. Anaphylaxis includes hypotension, bronchospasm, stridor, and urticaria. Treatment: immediate epinephrine administration is life-saving. Why not the other options? A. Activation of complement via the classical pathway. This is seen in type 2 hypersensitivity, e.g. hemolytic anemia, Goodpasture syndrome. Complement activation is not the primary mechanism in anaphylaxis. B. Deposition of immune complexes in blood vessels. This occurs in type 3 hypersensitivity, e.g. serum sickness, lupus nephritis. Anaphylaxis is not an immune complex-mediated disease. T-cell mediated cytotoxicity. This describes type 4 hypersensitivity, which is delayed 24 to 72 hours and mediated by CD8 plus T cells, e.g. contact dermatitis, TB skin test. Anaphylaxis occurs immediately after allergen exposure, ruling out a T-cell response. E. Delayed hypersensitivity reaction. Type 1 hypersensitivity occurs within minutes, not hours or days. Key takeaways for USMLE. Type 1 hypersensitivity equals IgE mast cells, immediate response. Hallmark conditions: anaphylaxis, asthma, allergic rhinitis, atopic dermatitis. Mediators: histamine, tryptase, leukotrienes. Immediate treatment: epinephrine for anaphylaxis. Would you like a question on a different type of hypersensitivity reaction?